right, so we've got a patient coming in that had a painful callus in the bottom of his foot, but on closer inspection, we believe that there's actually a piece of glass that's stuck in the bottom of his foot. So we've cleaned it up a little bit. We have not numbed this patient up because it seems to be pretty superficial. So what we're gonna do is we're gonna zoom in and we're gonna take a look, and we're gonna give him a little bit of cold spray, and that's gonna help just numb up the skin a little bit on the surface. We've already sterilized everything, so this is just a little bit of ethyl chloride, so it just kind of numbs up the superficial skin. It's just cold spray, and we can actually see that little piece of glass right there. So we're gonna use a Curette. So this is just almost like a looped blade, and we can kind of tease away at some of the skin that's holding the glass in place. And for something like this, when it's very superficial, we really don't need to put the patient through the pain of having to give them an injection unless we absolutely need to. So, you know, if this were to become painful for any reason, that's always an option for us. So as long as we take our time, we can see that piece of glass right there, and it's almost ready to come out. So we're gonna use our pickups. We're gonna grab hold of that, and there it is. Small piece of glass, but certainly you can imagine that'd be pretty painful in the bottom of your foot. Okay. Now we're gonna take a look at this portion here. Looks like there's a piece of glass there as well, and there was. Such a small piece, but causes quite a bit of pain. But you can see that was right there superficially. So now that they're both out, we're gonna clean up everything really well. Make sure there's nothing left behind. So again, this is a looped blade, call it a Curette, and we're just removing the dead layer of skin. So this shouldn't be painful for the patient. So we were able to get the glass out of the foot and didn't have to use an injection for any reason, which is a win-win, right? Because that would be more painful than just what we just took care of for the patient here. So we're just removing the dead skin, making sure there's nothing left behind, and everything looks clean. So we should be in good shape. All right, very good.